Hi everyone, my name is Joshua Gomez and I'll be presenting on pneumonia and let's get started. Okay, pneumonia, Streptococcus pneumoniae, which is the bacteria we're focusing on. So pneumonia, the bacteria infection caused by the Streptococcus pneumoniae. Mostly the common pneumonia is the lung infection. The Streptococcus is also known as another term for it is the pneumococcus. Is a type of bacteria that causes new illness. These infections can be any parts of the body as well. Okay, some commonly found in the respiratory tract and may isolate from the nasopharynx. And adults can get it by 5% to 90% of them, and children as well for 20% to 90%. So some signs of symptoms um, uh, can be spread from the coughing, sneezing, talking, and as well as respiratory droplets from the air. Um, these signs could be chest pain, hard breathing, confusion of mental awareness, fatigue, fever, nausea, sweating, shaking, and as well as shortness of breath. So some characteristics of pneumonia would be it's gram positive, it's a streptococcus, it's spherical bacteria. It's a facultative aerobic member of the genus of Streptococcus, and it's also alpha humidic and beta humidic. So some predisposing factors are people of the age of 65 and under the age of 2 as well. Uh, these factors can be with people living with lung conditions and heart conditions as well. And people can get it from hospitals and long-term facilities. And then smoking as well, pregnant women or at birth, weak immune systems. So according from the CDC, mostly about 55,000 of people are dying from each year from this bacterial infection. And it's mostly common in the US and as well as developing countries. So the chain infections. So the port of entry is the upper respiratory tract, and then the transmission is direct person to person contact. The reservoirs are humans. The infections agent is bacteria, fungus, and fungi. Susceptible hosts are infants, children, adults, over or younger the age have these health problems as well. So the portal of exit will be the mucous membrane and opening of the skin as well. Okay, the life cycle of pneumonia, the adhesion of the of Staphylococcus pneumoniae indicates its ability to adhere the surface of the host cell. Then it invades the host cell and the tissues, as well as the mechanism of the significant ones being invasion of the respiratory epithelial cells. Then it goes to phagocytosis resistance. Then it resists the attack from the phytogenic cells and achieved from the various mechanisms that it releases from the vulnerable factors, including the hemolysins, proteases, and adolescents. Then it goes to the phytogenic phenotype. Then electrically close links availability to withstand attacks and the host immune system. After that, it dies. So some treatment and diagnosis. For the diagnosis, the pneumonia health provider care would ask the patient's history and conduct a visual exam as well. And by checking by their using a stethoscope by checking their lungs, using a proximity oxygen or O2 proximity, it's to check their oxygen level as well, and X-rays to check for any diseases from their back or their ribs, and other tests as well. So treatment of antibiotics and oxygen therapy, the viral medications and fungal medications, and IV fluids. Mostly in my research, it's mostly antibiotics can treat pneumonia as well. Okay, and that'll be it. And thank you for listening, guys, and ask me questions. Thank you.